Up through the year 1865, the United States did not have a single seed oil. No one had ever tasted one. 1866, the first seed oil, cottonseed oil, entered the food supply. And cottonseed was a waste product from the cotton industry. But Americans knew that they only knew cottonseed oil mostly for lamp oil and for machine oil.
Yeah.
And so even though they were trying to sell this product, cotyledone, as a food, they weren't buying. Americans really didn't want to buy it. So it's soybean, cottonseed, corn, canola, rapeseed, grapeseed, sunflower, safflower, rice bran, sesame, peanut oils. That's basically the seed oil, the industrial seed oil.
To generate 5 tablespoons of corn oil, you needed 98 ears of corn.
They're crushed, heated, pressed, and then chemically alkalinized, chemically bleached, chemically deodorized. Then you go to a petroleum-derived hexane solvent bath. And the hexane extracts the oil, the additional oils out of the seeds. Then they treat that with heat and steam to evaporate off the hexane, because otherwise it's extremely toxic. But then you go into your chemical alkalinization, bleaching, and deodorizing stages. And the deodorization is absolutely fundamental and critical because the oils are so oxidized.
Why do so few people know about this? As more and more people start to focus on their health, they inevitably start to hear of the dangers of seed oils. I myself had heard about them and started using coconut oil, olive oil, and butter as a preference in my cooking. But even with some basic knowledge about how toxic seed oils might be, my conversation with Dr. Chris Knobbe shocked me completely. Chris is an ophthalmologist and clinical professor, formerly at the University of Texas Southwestern Medical Center in Dallas. He left practice to develop research on how age-related macular degeneration, or AMD, which is degeneration of vision previously attributed to old age, and now with Chris's works found to have a very high correlation with diet. This and other chronic health diseases result from highly processed seed oils, also known as vegetable oils, that make up 1/3 of the modern diet. Yes, you heard that right, 1/3. Today, they comprise the bulk of ultra-processed foods. Chris is the founder and president of Cure AMD Foundation, the author of The Ancestral Diet Revolution, and the chair of the MAHA Fats and Oils Committee, the organization that was set up by Robert F. Kennedy Jr. to tackle the modern health crisis in America and the rest of the world. This is really an especially timely conversation as the US dietary guidelines, which infamously brought us the outdated food pyramid of the 70s, the current My Plate, and what might be an entirely new food paradigm, are due to be announced this month. I know that many of you are reprioritizing diet and healthy living today, so I am especially thrilled to introduce you all to Chris Knobbe, who will change the way you think about everything you eat. Chris, thank you so much for joining the show. I'm super excited about doing this podcast.
Thanks for having me on, Rich. It's an honor and a pleasure. I appreciate it.
So, you're a physician and a public health advocate focused on seed oils within RFK's nonprofit that he originally set up, Make America Healthy Again. Maybe you could just give us some context as why this is so important for RFK, for Americans to be focused on this subject matter.
Yeah, sure. I think everyone sees that there's been a disastrous health transition in the United States, and this is following in all of the world, as you probably know. Let me give you some examples. So in the United States, obesity was 1.2% in men in the late 19th century. So right around 1880 to 1917, obesity 1.2%. It has steadily grown to 42.5% obesity by 2018. That's a 35-fold increase. And another 31.2%, I think is the number, are overweight. So there's 73.6% of Americans are now either obese or overweight.
Wow.
Diabetes. So diabetes was proven to be, the prevalence was 0.0028% in 1890. Sir William Osler, the most famous physician of the last several centuries, reported this. That's about 1 in 36,000 people with diabetes. So out of 63 million Americans in 1890, there was about 1,750 roughly that had diabetes. In 2023, that number has grown to 15.8%, and I think it's 38 million or so people. So we went from 1 in 36,000 people having diabetes in 1890 to whatever this is, 130 some years later to 1 in about 7 or so, whatever 15.8% would be. So that's obesity and diabetes. Cancer deaths. So in the year 1811, cancer took the lives of 1 in 188 Americans. It's about 0.5%. That grew to 1 in 17 by 1900, all the way to 1 in 3 by 2010. That's a 62-fold increase in cancer deaths. Coronary heart disease deaths were virtually unknown in the 19th century. The first documented heart attack and coronary heart disease death was in 1912. And there was only about 300 coronary heart disease deaths in 1922. It grew to an astounding 600 and some thousand in 1972 is when it peaked, and then it's come back down, and we're still down at 340 some thousand, I believe is the number of coronary heart disease deaths in 2022. So we're up tens of thousands, if not millions of percent, depending on what numbers you want to really look at. It's the same thing with like Alzheimer's disease. The first case diagnosed in 1908 by a physician, Alois Alzheimer, in 1908. There was something like, if I remember right, there was something like 50 cases or so in around 1950 documented in the world. 55 million a couple of years ago, with 10 million new cases per year. It's one new case every 3 seconds. Age-related macular degeneration, the same thing, leading cause of irreversible vision loss and blindness in people over the age of 50. There was less than 50 cases in all the world's literature between 1851 and 1930. Today, as of 2020, there was 196 million cases, on target to be 288 million by 2040. Wow. So all of the chronic diseases have grown from either unknown or rarities to the most common. They are the most common causes of death, and even our little children know what these diseases are. Right? They're so common.
Yeah, and I think obviously, we've talked about this offline as well. Unsaturated fats or saturated fats are being blamed a lot for the heart disease issue, and then polyunsaturated fats are not really being discussed at all. I mean, I think it would be great if you could just explain just why seed oils are so toxic, but also why no one seems to know about this. I mean, I was telling you before, I was in a restaurant the other day with my son, and I asked the server, "What are you cooking your French fries in?" And he said, "Don't worry. It's not beef tallow.
Right.
It's vegetable oil."
Right.
At which point my son, who has heard me banging on about these things, started laughing. He's like, "Can't believe that he's being so proud that he's poisoning you." But how is it that so few people really and when you're in the restaurant business, I've spoken to multiple restaurant owners and suggested that they start using beef tallow for their French fries, and they're like, "Why would we do that?" So why is the education gap so large? And maybe just before we get into that, how toxic really are these seed oils?
So the way that seed oils got into the food supply, let's just talk about America, because it gets complicated when we talk about the whole world.
Sure.
And I'll come back to the world, but in America, if we focus on that for the moment, up through the year 1865, the United States did not have a single seed oil. No one had ever tasted one in the United States. And
so that's, sorry, 65.
1865, yes. 1865. And so that's when the American Civil War entered. And right after that, so 1866, the first seed oil, cottonseed oil, entered the food supply. And cottonseed was a waste product from the cotton industry. But Americans knew that they only knew cottonseed oil mostly for lamp oil and for machine oil.
Yeah.
And so even though they were trying to sell this product, cottolene, as a food, they weren't buying. Americans really didn't want to buy it. And so mostly the next thing they did primarily was they began to adulterate olive oil with it. And they were so successful at this, quote, successful at this, that we sent over, I believe, 70-some thousand barrels of so-called olive oil to Europe, and the French made complaint in 1880, formally made complaint to the American government because they knew it wasn't olive oil. But eventually, we made Crisco, which is partially hydrogenated oil. That came from Procter & Gamble, entered the food supply in 1911. Then you got all the other oils. So basically, we ended up with, so it's soybean, cottonseed, corn, canola, rapeseed, grapeseed, sunflower, safflower, rice bran, sesame, peanut oils. That's basically the seed oils, the industrial seed oils. And these gradually supplanted animal fats. So up through almost all of history, everywhere where people didn't have olive oil, they mostly cooked in animal fat, which would be lard, butter, and beef tallow. And that's the way it was in the United States. So, for example, in 1900 in the U.S., 99% of added fats came from animal fat, lard, butter, and beef tallow. But by 2005, 86% of added fats came from vegetable oils. So in terms of the added fat, we almost completely replaced our animal fats. And with that came all this onslaught of disease, and the correlations are incredibly close with all of these: coronary heart disease, cancer, diabetes, metabolic syndrome, Alzheimer's disease, dementia, age-related macular degeneration, autoimmune diseases, all going up together.
So, I mean, obviously the correlations are high, and that's what, when scientists are looking at this type of thing, that's what people are looking for. Why do so few people know about this?
I think the main answer to that is because vegetable oils have sort of been grandfathered in to the food supply. They entered the food supply quietly, and then they were gradually elevated in the food supply. We were told they were healthy, like Procter & Gamble. They used a huge marketing campaign in the early 1900s, millions and millions of dollars. They gave out millions of cookbooks intended to go to mothers, and with every single recipe containing Crisco. And they used all kinds of catchy phrases, it's the cleaner cooking fat, the healthier cooking fat will make your children more, make them behave better, or something like that, make them more, insinuating it would make them more intelligent. And then what's happened is, as we approached around 1950s, they started determining that vegetable oils lowered cholesterol. And with the whole cholesterol concern, that was another sort of a boon to support vegetable oils. And that's persisted to this day. There's a belief system that because vegetable oils reduce your LDL cholesterol, total cholesterol, that they're therefore healthy. Like, for example, arsenic is one that will, it could raise your cholesterol, but it can also lower it effectively. And so just because something lowers your cholesterol doesn't mean it's good.
Yeah.
And, but anyway, so by and large, they've been grandfathered in, they've been just readily accepted, and most all of the research throughout the ages, they've looked at fat in general, but they didn't most of the time they're not separating animal fat from vegetable fat or vegetable oils. And so we don't have good evidence in studies to point the finger at vegetable oils.
Yeah, I think you mentioned a very interesting stat. When I heard it, I was just shocked that now seed oils are a third of our calorific intake. It just seems a remarkable level. I mean, it basically means that they're in everything.
Mm-hmm.
How do you, you've covered it to some degree, but how do you feel we got to this level of penetration of our entire food supply?
Well, it was mostly born out of manufacturing desire for profit. Because let's face it, seed oils were never put into our food supply because they were healthy.
Mm.
They were they're born out of the Industrial Revolution, which birthed the edible oil industry, and the edible oil industry knew that the more oil they could make, the more money they would make.
Mm.
And this is a multi-billion-dollar industry in the United States today. And yes, we went from 0 grams of seed oils, absolutely zero in the United States in 1865, to 80 grams per person per day by 2010. And 80 grams is 720 calories. Now, that's the amount of food that would actually reach the consumer. So there are some plate losses there and other cooking losses. But suffice it to say that the average American is consuming around a fourth of their diet or more from most, and that's not entirely seed oils, but in 2010, 89% of that was industrial seed oils. And the other 11% was olive oil, coconut oil, and some palm kernel oil. And that's about it.
So, you've talked about how much we're talking about here, 80 grams per day. And I read a stat recently, which was highly concerning, that to generate 5 tablespoons of corn oil, you needed 98 ears of corn, which just seems, obviously very intense processing to get to that level. And obviously it doesn't intuitively feel like our bodies are equipped to be able to process that.
Right.
So, maybe you could just explain a little bit the industrial process behind the production of these oils that are now such a huge part of our diet.
Yeah, and if you could eat 98 ears of corn, that would be fine.
Yeah.
It's although no one would ever do that, but I realize it would probably take most people a week or weeks or whatever to eat 98 to eat 98 ears of corn. But the issue, yes, is the processing. So industrial seed oils, they're called RBDs. They're refined, bleached, and deodorized. What happens is so that you take the seeds. Normally, these are all seeds, and in the so-called seed oils, and they're crushed, heated, pressed, and then chemically alkalinized, chemically bleached, chemically deodorized. Oh, I forgot. I'm sorry. After you crushed and pressed, then you go to a petroleum-derived hexane solvent bath, and the hexane extracts the oil, the additional oils out of the seeds. Then they treat that with heat and steam to evaporate off the hexane, because otherwise it's extremely toxic. And they do remove almost all of it.
Mm-hmm.
But then you go into your chemical alkalinization, bleaching, and deodorizing stages. And the deodorization is absolutely fundamental and critical, because the oils are so oxidized, and think of that like rusting, but so oxidized that they would have the most severe malodorous air to them, because it's the same process as rotting fish. So rotting fish stink because the omega-3s primarily, they're rich in omega-3s. Seed oils are rich in omega-6, but when they oxidize, they stink. So they have to go through this deodorization. They do that with high temperature and usually steam, reaching temperatures of over 500 degrees. And during those stages is when they produce these advanced lipid oxidation end products. So because the seed oils are rich in omega-6 fats, which have multiple double bonds, they're very highly subjective to oxidation, where saturated and monounsaturated fats are not. So you reach these multiple temperatures, very high temperatures, oxidizes the omega-6, and that produces what are called advanced lipid oxidation end products. And these are chemicals like 4-hydroxynonenal, malondialdehyde, 9 and 13-hode, carboxyethylpyrrole, acrolein. All of these are toxins.
Yeah.
Like acrolein is the same toxin that is the primary toxicant of cigarette smoke. And vegetable oils and cigarette smoke have one of the same major toxins.
They sound absolutely toxic.
They are.
You mentioned offline earlier that there was some significant work that was being done by your team at MAHA to essentially educate the American public. You will maybe talk about what's being done to try and help people understand how toxic these things are.
Yes, absolutely. Well, first of all, so I had the good fortune of being appointed as to chair the committee on the MAHA, Make America Healthy Again, Fats and Oils Committee. And on that committee, I'm working directly with Dr. Eric Berg, who has an enormous following, like 32 million people on YouTube. And but what we've done is, so we're collaborating with something like 60 or 70 mostly podcasters and health influencers, and collectively we're able to reach millions and millions of people. And so that's what we're doing in the MAHA Fats and Oils Committee. Is because I don't really have a big following. I've never worked to do that. I've spent all my time working in science. Our goal is to reach Americans as broadly as we possibly can with this message that seed oils are dangerous.
Yeah, well, I think it's unfortunately not just America that is suffering from this epidemic.
The whole world is. I can speak to that too. Yeah,
please.
Yeah. So here's what's happening around the world is that now this boggles my mind. The United States is the single most unhealthy of all of the developed nations. We're the most obese of the diabetic nations, for example. We spend almost twice as much on healthcare as the next most wealthy country in the world. And yet we don't rank in the top 40 in terms of health, and our lifespan is going down. Again, we're one of the most obese, diabetic, sickly nations there is. And yet, why is the world doing what we do? Around the world? The world is particularly the seed oils. They follow this belief system that, the soybean oil and canola and cottonseed and all these oils, that they lower your cholesterol, so therefore they're good. And we've spread this message around the world, and we've devastated the world with this misinformation. And that's what it is.
Yeah.
For example, we've devastated the health of Pacific Islanders, who once were the most supremely healthy people on the planet. And we've devastated their health because we've told them to get rid of their coconut oil, which is 98%, or sorry, not 98, 91 to 95% saturated fat. And they were brilliantly healthy on that. Now they've gotten rid of their coconut oil, and they're using, guess what? Soybean, canola, cottonseed, and other highly polyunsaturated oils that are just devastating.
We should touch on that quickly.
Sure.
For viewers who want to obviously opt for healthier alternatives, coconut oil,
yes,
olive oil, and then, of course, animal fats.
Yes. So, in our house, we cook everything in butter.
Okay.
We just try to get grass-fed butter, but any kind of butter or ghee, the same thing. To me, that's the healthiest fat to cook in. Tallow would be the same, if not better, but it's just as good. There could be some arguments but tallow would have more vitamins A, D, and K2 than even butter would. But those two would be best. And if you need a lot of oil, coconut oil would be very good. If you don't want the flavor of coconut oil, you can even use refined coconut oil. This is one case where you can use refined oil because coconut oil, the refining is just steaming. All they do is steam it to remove some of the flavor, so you don't have the coconut flavor, but it's still going to be roughly 95% saturated fat and 2% omega-6 linoleic acid. Let me point out, Rich, that 2% omega-6 linoleic acid in coconut oil and in butter and in tallow, roughly, they're all about the same. Whereas soybean oil, the single most used oil in the United States, 56% omega-6 linoleic acid. Safflower oil is around 78% omega-6 linoleic acid.
Gosh, so sunflower oil is the worst.
Safflower oil is, and at least in terms of omega-6, it's the worst. I don't know that we could truly classify one of them as the worst because some may be higher in those advanced lipid oxidation end products than others, depending on the processing they underwent. But they all have these lots of advanced lipid oxidation end products, all of it. So the seed oils, let me just say this real quick, run the gamut in terms of omega-6 from a low in canola oil of 20% omega-6 linoleic acid up to 78% in safflower oil.
Right.
And again, keep that in mind that the omega-6 in animals like beef fat, butter, coconut oil, those are all going to be around 2 to 3%, 1.5 to 3% omega-6 linoleic acid. And you need to keep that low because that's natural. That's completely natural. That's all this is about. It's just going back to nature. Seed oils are the single most processed, pernicious, insidious ingredient in our food supply, bar none. There's nothing even close to being processed as much as seed oils.
Yeah, I think that's also key is just the level of processing. When you're talking about bleaching it, you're talking about deodorizing it. It just sounds absolutely insane.
Yes.
That we would then eat that or have that as such a huge component of our food supply. Interesting element that you and I talked about earlier again is the link between sunburning and a high seed oils diet. Do you want to maybe just talk to the correlation there?
Yeah, sure. So again, when we consume whatever we're consuming in terms of our fatty acids, that's ultimately reflected in our own body fat, our fat, wherever our fat is, and which is under our skin, it's in around our organs, it's everywhere. So that omega-6 then increases under our skin as well, and when you're exposed to sunlight, that actually causes that omega-6 to oxidize, just like it does everywhere else, which is what leads to all the problems, the oxidation. And so this is mostly anecdotal, but numerous people have noticed that when they went on a low omega-6 diet, in other words, they mostly just got rid of seed oils, that they could be in the sun for hours. And these are some people very light skinned who could burn in 15 minutes. And they now can be in the sun for 2-3 hours and just barely burn or not burn at all.
I've stopped using sun cream the last 2 years. And obviously I'm not like lying out in the sun for hours on end, but like I'm not getting burnt in the same way that I used to. Is interesting. And I don't know if that's sort of a real correlation or not, but I've certainly seemed to have noticed this.
Yeah.
So let's carry on just for one more question, just to think about, the health impact here. I think a lot of vilification, I certainly, when I started really focusing on my nutrition and health, started cutting sugar aggressively. And I think that has been, identified as the main demon in our diet. How do you feel about, sugar or high carbohydrate diet versus seed oils and the various different pros and cons?
Let me say this, that first of all, for the last 9 years, I have spoken and written about reducing processed foods or reducing or eliminating processed foods. And processed foods are primarily made up of 3 or 4 things. And it's refined sugars, refined carbohydrates, which is mostly refined grains, and vegetable oils. And then there's trans fats. But the trans fats, the industrially produced trans fats, they come only from seed oils. And so, but these are all nutrient deficient foods, and the seed oils and trans fats are the toxic part of that for the most part. So I believe in trying to reduce or eliminate all of those, and I always will. But if you look at all of the evidence, what we see in country after country and even in the entire world is, for example, you see very little correlation between sugar and carbohydrate consumption and all of this disease. Like, for example, here at the Public Health Collaboration this past weekend, I just presented evidence in 18 countries that covered, there's more than half of the world in terms of population. And in the past 60 years, vegetable oil consumption in those 18 countries tripled. All right. And during that time,
So you said 18 years, last 18?
No, I'm sorry. In the last 60 years.
6 years.
Yeah. So there's 18 countries that account for more than half of the world's population. And in the last 60 years, which is when we've had the explosion of obesity and diabetes and chronic disease in the world, the last 60 years, the vegetable oils tripled in the world. During that time, the carbohydrates are completely flat. They have not changed. And in the last 45 years, in those 18 countries, sugar consumption was flat and then recently going down. We need to have correlation to prove causation. That's the most important element to inferring causality. Number one is correlation. This is Bradford Hill criteria. Criterion number one, he called it strength of association, which is another way of saying correlation or correlation coefficient. And so if sugar is flat or going down while obesity and diabetes are going up, what should that tell us? That's very powerful evidence that it's, and I'm not, again, I have to say this over and over, I'm not telling people to go eat sugar. I avoid sugar most all the time, all right, because it's a nutrient deficient food, but it's not. I'm trying to give perspective so people know what is the most important thing to do, and you can't fix your risk of all these diseases by eliminating sugar. It just doesn't work. Low carb diets are working primarily because every time you reduce carbohydrates, like with the potatoes, the pasta, the rice, for example, think about this. They're all associated with seed oils. All the plates of food. Think of everything you think of. Where are the seed oils hiding? Because they're hiding, right? You don't even see it on your plate. They're hiding in the rice, the pasta, the potatoes. They're hidden in the low carb or in the carbohydrate portion. And so when people take out, they go, okay, I'm no longer eating any carbs. They just almost without fail, they're going to remove a whole bunch of vegetable oils. And this is why they're working.
This is so interesting because, if you think about the Mediterranean diet, I have a few Italian friends. We actually have quite a few Italians at C's Capital. And when you ask them about seed oils, they're like, no, we use olive oil in everything. Right? And it's funny because they have a very high carb diet. But actually, they're all in very good shape. But it's because olive oil is everywhere. They will not use another oil because it's almost offensive to suggest that they would use another oil than olive oil in their cooking. It's interesting.
And if you think about the entire Asian culture, what did they live on? Still mostly, but what did they live on for the last several centuries? Mostly like rice. I mean, think about the Japanese in up till 1960, their diet was 84% carbohydrate. That's almost entirely white rice on mainland Japan. In Okinawa, that was traditionally all sweet potatoes. So their diet was, in mainland Japan, white rice, fish, and vegetables. Fantastically healthy people, right?
Yeah.
And then what happened is Their carbs started going down. Their sugar has gone down since 1989. Their calories went down. Their obesity doubled. Their diabetes went up 325-fold, I think it was. Macular degeneration went up 82-fold. I forget what all, but it all happened with an increase in vegetable oils from 9 grams a day in 1961 to 39 grams a day by 2004. Again, while their calories, their carbohydrates, and their sugar were going down. But the answer is it's vegetable oils, There's no other answer. High carbohydrate diets have worked fantastically for numerous populations around the world throughout history.
Yeah.
That's not the problem.
We always like to talk about the next generation, how we can help our kids. My daughter particularly is a big fan of all these horrible foods that are full of seed oils like M&Ms and Oreos. I find these, and crisps. I find these packets hidden away in her drawers in her room where she's tried to hide from me that she's eating this stuff. But, obviously it's not just her on her own, her friends like all this. And, certainly at that sort of teenage age, it's very hard to sort of stand up and say, oh no, I'm not going to eat that, I'm not going to eat that, I'm not going to eat that, and constantly be the one standing out. So is there something that we can suggest to these younger generations that they should be focused on in terms of what they're eating to make it a little bit fun?
I mean, personally, I mean, the low carb camp wouldn't appreciate this at all, but I think we can't we shouldn't try to take out all of the fun in food. And I think desserts can be fine. I mean, 19th century Americans loved their desserts, and they didn't have, obviously, they didn't have almost any chronic disease or obesity, right? But they didn't have seed oils. I think the most important thing, honestly, is just, no one misses seed oils. Just get them out of your house and try to get them out of your diets completely. And then what we've done, like with our daughter, of course, she's 26 now, but what we did over the last, 12 years really is just model, her mom and I was just model an ancestral diet. And now she just naturally follows it.
Nice.
And we didn't jam it down her throat or anything. We just, mostly again, just modeling is all it took. And now she's lean and fit and healthy as a horse, at age 26.
Awesome.
Yeah.
Final question I always like to ask, Chris, is obviously you're an expert in this area. How are you thinking about allocation of your own capital, but also how can we propagate a better future through allocation of capital?
Well, thanks for bringing that up. So I run 2 nonprofit foundations, Ancestral Health Foundation and Cure AMD Foundation. And AMD stands for Age-Related Macular Degeneration. And I've funded these organizations originally out of my own pocket until we had philanthropists helping to fund us, but to fund the work that we do, my travel and so forth, and all the researchers that help do the work that we do. But so my monies have gone into those organizations, and we do need support. But I want to mention that it will require a tremendous amount of research to prove to the world that what I'm talking about here today is true. And we will need to study ancestrally living populations around the world and compare and contrast them to their genetic cohorts who have westernized their diets. It's the only thing that can, quote, prove this seed oil hypothesis that I'm presenting and discussing with you today. It'll take very hard science, and it's going to take a lot of work, and it's tremendously expensive. But it's a drop in the bucket compared to what even America has spent on even a single study. I mean, what we could do with $20 million worth of research on 6 ancestrally living populations around the world could change the world in this regard. And all of the research that's been done to date can't prove any of that. And they've spent probably over $100 billion on just really worthless research that can't answer these questions.
Chris, I want to thank you for the work you're doing. I want to thank you for being here today to help our audience understand this. I mean, intuitively, it just sounds absolutely logical. We need to remove these things from our diet.
Yeah.
So thank you. Thank you for being here.
Thank you so much, Rich. It's been an honor and a pleasure. I appreciate it.
Cheers.
Cheers.